Okay, imagine this. You're at the doctor's office, right? Dealing with some health thing. And naturally, doctor's looking at your lab tests, maybe some scans, doing a physical exam, all that objective stuff. It's crucial. We know that. Tells a lot. But have you felt like maybe those numbers, they don't quite capture the whole story?
Yeah.
Like what you're actually going through day to day?
Yeah, the human side of it. So to really sort of paint a picture here, let's talk about Sarah and Tom. Now, they both had the same kind of arthritis. After 6 months on a new treatment, their clinical results, blood tests, joint exams, all that looked pretty much identical. Looked like a win-win, right? From a purely sort of biological viewpoint.
Exactly. But this is where it gets really interesting. Because if you actually ask them how they were doing, well, you get two totally different stories. Sarah, she's thrilled. She tells you she's back in her garden, planting things again, sleeping right through the night. She even has the energy to play with her grandkids. Her words were something like, "I feel like I've got my life back." Really powerful. But Tom, well, Tom's a different story. Even though his joints are less swollen on the tests, he's hit with this awful, just constant fatigue. Turns out it's a side effect of the treatment. He can't concentrate at work anymore. He's had to give up his evening walks. I mean, his lab results look great, but his actual quality of life, he says, it's completely tanked.
Wow, and that just nails the key question, doesn't it? How do we actually measure that huge difference? How do we capture Sarah's joy about gardening or Tom's crushing fatigue? The real stuff that impacts your daily life, the things those objective tests, important as they are, just don't see.
Well, this is precisely where patient-reported outcomes, or PROs, come into play. Think of them as like the essential bridge. They connect that objective clinical data with the subjective lived reality of being ill.
Yeah.
They let us really hear Sarah's happiness and Tom's struggle directly from them.
And what's really key here, I think, is that PROs aren't just like casual comments or stories. They represent the patient's own voice, but captured systematically. They're measured rigorously, turned into powerful, quantifiable data. It's really about taking the patient's perspective and making it not just something you listen to, but a core central piece of the medical evidence. Okay, right. Let's unpack that then. Today we're going to dive deep into these often unsung heroes of healthcare data. We'll explore exactly what PROs are, why they're becoming so incredibly important for truly understanding health, and how they're actually starting to shake things up, changing everything from your next doctor's visit all the way to how new drugs get approved. It's really about bringing in a new era, one that's genuinely centered around you, the patient. So maybe the best place to start to really grasp their impact is with a clear definition. What exactly is a patient-reported outcome?
Right. So at its core, a patient-reported outcome, a PRO, is basically any report about a patient's health status that comes directly from the patient. And critically, it's without interpretation or like filtering by a doctor or nurse or anyone else. That without interpretation bit is absolutely key. It has to be the patient's unfiltered, authentic take on their own symptoms, how well they can function, their emotional state, things like that.
Okay, but how is that really different from other health info? Because, when my doctor asks me how I'm feeling and writes it down, that feels pretty direct too.
Yeah, that's a really good point. And it is a common source of confusion. What you're likely thinking of there is what we call clinician-reported outcomes, or CLINROs. That's when the doctor or nurse observes something and records it, like a dermatologist grading how bad a rash looks, or a doctor assessing how easily you can move a joint. That's their observation. You've also got observer-reported outcomes, OBSROs, which might come from, say, a parent describing their child's symptoms, or maybe a spouse. All incredibly valuable data points, don't get me wrong, but only PROs give you that direct pipeline into the patient's own subjective lived experience, their personal reality.
Got it. So if it's directly from the patient, what sort of things are we actually learning? Are there like surprising insights that PROs bring to light? Maybe things we wouldn't normally think to ask about, or perhaps areas where what the patient says even contradicts the traditional clinical numbers?
Oh, absolutely. PROs let us capture the whole kind of spectrum of what a patient is going through. We're talking subtle things like that fatigue we mentioned, which blood tests just won't show. Or the real impact on just, doing everyday things, getting dressed, cooking a meal, things a doctor might only guess at from an exam. It includes the true severity of symptoms, pain, nausea, anxiety, depression, from the person actually feeling them. But also, functional stuff. Can you walk up the stairs? How's your sleep, your overall mood, your satisfaction with the treatment itself? And sometimes, honestly, a patient telling you they can now, say, manage their grocery shopping again is way more meaningful to them than a small change in some lab value.
Right. And how do you actually collect all this? Is it just like a chat during the appointment. I can imagine getting tired of filling out forms all the time. Survey fatigue,
Yeah, survey fatigue is definitely real. No, it's generally not just a casual chat, though that's important too. It's usually done using carefully designed, this is crucial, validated tools. We call them PRO measures or PROMs. These are typically standardized questionnaires or surveys. They could be on paper or maybe on a tablet in the waiting room. Increasingly, though, it's through mobile apps or patient portals you can access from home. Much more convenient. And that validation part I mentioned, it's super important. It ensures the questions are clear, reliable, and actually measure what they claim to measure. So when a patient circles a 7-point on a 10-point pain scale, that 7 has a consistent meaning for them over time. And we can meaningfully compare it, perhaps cautiously, across different patients using the same tool. And yes, designing them to be easy and not too burdensome, avoiding that homework feeling, is a constant focus.
What you're describing feels like more than just collecting new data points. It sounds like a pretty fundamental shift. Can you talk a bit about the bigger picture, sort of philosophical change here?
Yeah, I think it really is fascinating, actually. It reflects this profound and, I'd argue, deeply necessary shift in the whole philosophy of healthcare. We're definitely moving away from that older, perhaps more paternalistic model, where the doctor was kind of seen as the sole judge of whether treatment worked. We're moving towards truly patient-centered care. And in that model, well, the patient is an active partner. Their values, their preferences, what they experience day to day, they become central to making decisions, every single decision, ideally. And PROs, they're the practical tool, the mechanism that actually makes that philosophical ideal a concrete reality in the clinic.
Okay, so we've got a handle on what PROs are. Now, how does this actually change things? In a real doctor's visit, or even in like a research lab, because collecting them is one thing, but integrating them, using them systematically, that feels like where the real revolution happens. The impact seems huge. Maybe start with how they're improving things right there in the clinic with direct patient care.
Right, at the bedside or, in the exam room, PROs are genuinely transforming the conversation. Imagine your doctor having your PRO report before you even walk in. They can start the visit by saying, okay, I see from your answers last week that your fatigue has been much worse, even though your pain score is a bit better. Let's talk about that fatigue first. See how that immediately zeroes in on what's actually bothering you most. It paves the way for truly personalized treatment plans and what we call shared decision-making. It helps answer that fundamental question, what matters most to you right now?
That does sound like a big shift, a better conversation for sure. But I can imagine some doctors might, find it adds complexity. How do clinicians typically adapt to using this kind of subjective data?
That's a fair point. And yes, there can be a learning curve initially. Integrating it smoothly takes some effort, some changes to workflow. But the benefits often become clear pretty quickly. For one thing, PROs act as this incredibly effective early warning system. Take oncology, for example. Patients getting chemo can report side effects, nausea, fatigue, whatever in real time, maybe through an app on their phone. If a severe symptom gets flagged, say, their nausea score jumps way up, the system can alert the care team. That allows for early intervention, maybe a call from a nurse, adjustment to medication before it escalates into a crisis needing an emergency room visit or hospitalization. It could literally keep people out of the hospital. They also give a structured way for patients who might maybe a bit shy or find it hard to put things into words to communicate their concerns effectively. And for chronic conditions, arthritis, diabetes, heart failure, you name it, tracking PROs over time gives everyone a powerful way to see if a treatment is really working from the patient's point of view beyond just the latest lab results.
Okay, that makes sense for individual care. But moving beyond that, how are PROs changing things in, like clinical research, developing new drugs? That feels like it could be massive, too.
Oh, it's monumental if you connect this to the bigger picture, yeah. For decades, clinical trials, testing new medicines, they focused almost entirely on clinical or biological endpoints. Things like, did the tumor shrink on the scan? Did the blood test number improve? Did the patient survive longer? Important stuff, obviously. But now, PROs are increasingly being used as key endpoints themselves, either primary or secondary. So for a new drug for, say, multiple sclerosis, a crucial outcome might be the patient's reported ability to walk a certain distance, or the reported level of fatigue, not just what an MRI scan shows. For new antidepressant, well, the most important outcome is arguably the patient's own reported reduction in depressive symptoms. That's what matters. And what's truly revolutionary here is we've seen cases where a drug's objective clinical data look maybe only okay, just modestly good. But the patient-reported outcomes data on things like fatigue or ability to do daily tasks, things really critical to quality of life, were so strikingly positive that regulatory agencies actually prioritize that patient experience data. They value the lived experience, sometimes even over the traditional numbers, and it contributed significantly to the drug getting approved. That's a real game changer in how we define success in medicine.
Wow, so the regulators, like the FDA and others, are really buying into this. They're saying, okay, the patient experience can actually be a deciding factor.
Exactly. Agencies like the FDA here in the US and the EMA over in Europe, they now strongly encourage and sometimes even require PRO data to be included when companies submit a new drug for approval. A drug that can clearly show it makes a significant difference in a key PRO improving quality of life, reducing a really debilitating symptom like pain or shortness of breath. Well, that drug has a much stronger argument for its value to patients. And think about this too. When PROs are collected routinely as part of everyday care, not just in trials, that data becomes a vital part of what we call real-world evidence. It shows how treatments actually perform out there in the messy real world with diverse groups of people, not just the carefully selected patients in a trial. That's incredibly valuable information.
And it doesn't stop there, does it? I understand PROs are also starting to shape things on an even bigger scale, like public health initiatives and policy decisions.
Absolutely. What's truly transformative here is the potential power of aggregated PRO data, obviously anonymized to protect privacy. Imagine, for instance, creating a sort of symptom map for a city or even a whole country based on reported PROs. Public health officials can use that to spot communities maybe struggling with a high burden of unreported pain or anxiety or functional limitations that aren't showing up in hospital admission data. That allows for a much more targeted allocation of resources, maybe mental health services or pain clinics or support for people with disabilities. It helps us understand the true lived burden of different diseases across whole populations, way beyond just looking at mortality rates or hospital stats.
And what about judging healthcare systems themselves? It sounds like it's not just about clinical outcomes anymore.
Precisely. How do we really know if one hospital or one particular model of care delivery is genuinely better than another? PROs, along with their cousins, PREMs, patient-reported experience measures, which ask about the care process itself, are increasingly being used as key quality indicators. Think about it. A healthcare system might achieve fantastic clinical results on paper, but if patients consistently report feeling unheard, dissatisfied, or having a poor quality of life despite those results, well, you can't really call that a high-quality system, can you? This data also directly feeds into policy decisions, like which treatments should be covered by insurance or public funds. Where should we focus public health campaigns? If aggregated PRO data clearly shows that a certain condition massively impacts people's ability to work, for example, that provides a really strong economic and social justification for policies that support disability services, or maybe push for new workplace accommodations.
Okay, this all sounds incredibly promising and truly transformative. But let's be realistic. Rolling something like this out across huge, complex healthcare systems must face some serious challenges, right? What are the main hurdles we need to overcome?
Yeah, that's a really important point to bring up. The potential value is immense, no doubt. But actually implementing PROs effectively and system-wide, it's complex, very complex. First off, it's not just about asking any questions. You absolutely have to use the right PRO measure, the right tool for the job. That means using a questionnaire or tool that has been rigorously scientifically validated, tested to make sure it's reliable, it's accurate, and it's actually relevant for the specific condition and the specific group of patients you're working with. If you choose the wrong instrument, you're going to end up with data that's basically meaningless. Or even worse, it could be actively misleading, leading to bad decisions. So tool selection and validation is step one. Then there's that collection burden we joked about, the survey fatigue issue. We have to be really mindful of not overwhelming patients. Questionnaires can't be too long or asked too frequently. And for the clinicians, for the doctors and nurses, fitting PRO collection into an already jam-packed workflow can be tough. The whole process needs to be designed to be as seamless and efficient as possible, ideally integrating right into their existing systems. Otherwise, it just won't happen consistently. And of course, data quality is a perpetual challenge, making sure patients actually complete the forms, minimizing missing data, ensuring it's captured accurately. That all takes effort and good system design.
Right. So just collecting the data isn't the end game. It actually has to be used effectively, doesn't it? Put into action.
Exactly. That's critical. Interpretation and actionability. Collecting mountains of PRO data is completely useless if it just sits there in a database, unlooked at. Healthcare systems need to build in the workflows, the alerts, the processes, so that when a patient reports something concerning maybe a sudden spike in their pain score, or they flag severe depressive symptoms, it actually triggers a timely and appropriate response from the care team. Someone needs to see it, assess it, and act on it. The data absolutely must be actionable. And that requires really good technological integration. The PRO collection tools, whether they're apps or tablets, need to talk seamlessly to the main electronic health record systems so that the PRO data shows up right there alongside the lab results, the imaging reports, the clinical notes. It needs to be part of that complete unified clinical picture for the clinician looking at it. And finally, maybe one of the most important challenges is ensuring patient engagement and health equity. We have to make absolutely sure that all patients, regardless of their background, have the ability and feel encouraged to report their outcomes. That means tackling potential barriers, things like language differences, varying levels of health literacy, or maybe lack of access to smartphones, or reliable internet for digital tools. We need strategies to ensure the patient voices we're collecting are truly representative of our incredibly diverse populations. If we don't, we risk amplifying existing disparities and missing crucial insights from underserved communities.
Okay, so there are definitely hurdles. But given those challenges, and also thinking about the explosion in digital health and AI, what does the future look like for PROs? Where is this all heading?
Well, looking ahead, I think the future for patient-reported outcomes is incredibly bright despite the challenges. And it's definitely moving beyond just filling out traditional surveys. We're seeing a shift away from those static, maybe monthly or quarterly questionnaires towards much more dynamic and often lower burden ways of collecting this information. Imagine a smart mobile app that learns your patterns. It only prompts you for a quick rating of your main symptom, like pain, when it seems necessary based on your previous answers or activity levels. Or maybe it passively collects data from a wearable, like your step count from a smartwatch, as a sort of proxy measure for your functional status. And then it combines that passive data with maybe just one single targeted question each day about your overall mood or energy level. Much less intrusive.
Wow, yeah, that sounds much more efficient, almost invisible to the patient in some ways.
Exactly. And artificial intelligence, especially things like natural language processing or NLP, is going to play a huge role here. NLP techniques can analyze free text PROs. Think about, say, a patient typing a diary entry into an app about how their day went. NLP could potentially analyze that text to pull out meaningful themes, symptom mentions, or expressions of sentiment that a structured, multiple-choice questionnaire might completely miss. The ultimate vision, I think, is a future where PROs are just as routine, just as standard, just as valued in clinical practice as taking your blood pressure or ordering blood tests. They won't be an add-on. They'll be a fundamental data stream, seamlessly integrated into every patient's health record, providing this continuous, ideally real-time reflection of your lived experience. And that data will fundamentally shape every aspect of your care, from your individual treatment choices right up to large-scale health policy and research priorities.
You know, we started this deep dive thinking about Sarah and Tom. Two people, same condition on paper, but such vastly different experiences in their actual lives. And it really seems patient-reported outcomes are the key, aren't they? They unlock our ability to finally see that difference, to measure it, and crucially, to act on it.
They really do. PROs represent this profound and, I believe, absolutely necessary shift in healthcare.
Yeah.
It's a move away from looking at health just through a purely clinical, disease-focused lens towards a view that fully embraces the patient's lived reality, their whole experience. The patient's voice gets transformed, from just being an anecdote, a story, into essential quantifiable evidence. And that fundamentally changes how we define good care and how we deliver it.
Yeah. It drives home that truly effective healthcare. Well, it can't just be defined by lab numbers and scan results alone, can it? It has to be measured ultimately in terms of quality of life, your functional ability, your overall well-being as a whole person.
The guiding principle here is actually pretty simple, but it's incredibly powerful. We must listen to patients. Their experience isn't just a side story. It is vital evidence. Evidence that demands to be seen, heard, and integrated into every single level of healthcare.
So something for you to think about as we wrap up.
Right.
What does a truly good health outcome actually mean to you personally? And how important is your own reported experience, your voice, in your healthcare journey?
Yeah, and maybe take it one step further. If your voice is now considered vital evidence, what kind of new possibilities might open up? What happens when healthcare truly starts integrating what you report about your life? Not just what the tests are showing. It's something worth pondering.